everyone. So my name is Yong Chen, and I will be presenting to you this dashboard that I created that summarizes and analyzes data regarding COVID-19 deaths by age. This data set was collected from the CDC website. So we have the data set here. I actually use two data sets. The first one is just the general COVID-19 deaths and then the age group. The sex. This data range is from February 1st of 2020 to October 10 of 2020. There are a few issues with this data set. As you can see, there is the option of all sex for people that wanted to remain anonymous. There is also all ages for people that didn't want to specify the age of the person that passed. And then this data set only has a range. It does not have the exact date. As you can see, all the dates here are just the same date. So it's only the range. But this data set also specifies the states, with the other issue that people chose just to say United States. And the second data set I have is also from the CDC website, but this data set is very unique because it has the age group and the number of COVID-19 deaths, but also specifies if this person had some underlying disease and exactly what condition they had. So we can move on to the different pivot tables that I have. So the first one was the sex and the number of COVID-19 deaths. As we see, there is the option of all sex and unknown for people that wanted to remain anonymous. There's also the deaths by states. With this pivot table, we can see a lot of people chose United States for people that did not want to say exactly which state they were from. And then this one is the different types of illness or underlying conditions that they had, and they passed with along with COVID-19. So there is a group of people that just passed with COVID-19, but as we can see, there are other ones such as the flu, having some type of high blood pressure or some heart failure. Some people might have had diabetes and then respiratory failure. And then this is the general, pivot table that I wanted to focus on, which was the age group and the number of COVID-19 deaths. And as we can see, a lot of people chose all ages for people that did not want to specify the age group that the person belonged in. So now we can move on to the dashboard that I have. So this first table here, we can zoom in. And we have the age groups and the number of COVID-19 deaths. As you can see, most people didn't want to specify, but we can still, but using the remaining data that we have, we can still see an incline. So as age goes on, COVID-19 hits harder than towards people at the younger age group. This table, or this bar chart I have here, it shows the different diseases that you might have had alongside with COVID-19. As you can see, majority people might have just only had COVID-19, but ones that stuck out more is respiratory failure if you had the flu. And then there's also a group of people that chose to remain anonymous. They didn't want to say if they had any underlying conditions. But then we could see that high blood pressure is a big one, heart failure, diabetes. So there are, as we can see, respiratory failure is a really important one when it comes to COVID-19. COVID-19 is a virus that targets the lungs, but other underlying conditions also might have an effect on COVID-19. And then here we have the different states. So as you can see, most people chose United States. They didn't want to specify, but you can still notice that states such as Texas, New York City, New York, New Jersey, Florida, California, those are states that stood out more with more number of people that passed. And then this pie chart here summarizes the different sex. So of all age groups, there is 32% male and 26% female, but there is a huge age group that chose all sex because they didn't want to specify. So you can't deny the fact that there is a possibility that maybe more female chose to remain anonymous. So we can't necessarily say that more men pass from COVID-19, and we can't say that COVID-19 hits harder to the male sex than to the female sex. So I have 2 slicers here. I wanted to focus on the different age groups. I had to use 2 slicers because I had 2 data sets, and the age groups in the data set were slightly different, so I couldn't really put the 2 slicers together, but we can still select the ones that we want. So if I wanted to analyze ages 24, from 0 to 24, I will select the age range, and then, okay, so you see in the summary here, it automatically goes to the age group of 0 to 24, and it's around 2,500. In the younger age group, there is an increase of male that passed with COVID-19 compared to female. And then in the bar chart here, we can see that people that passed with COVID-19 had COVID-19 or some type of other underlying condition. And then we can also see that there is the flu. People had the flu. There's also a huge increase in obesity. So compared to the original graph, obesity was actually really low compared to all the other ones. As we can see, it's not that huge, but clearly in the younger age group, obesity is definitely a bigger issue. As you can see, there's a huge increase. Diseases like high blood pressure, diabetes is less, and then you can also notice that younger people tend to not have Alzheimer's. Alzheimer's is a disease that is targeted towards older age, so no one with Alzheimer's passed. And then if we move on to the states, a lot of people still chose United States, but there's Texas, New York City, New York, New Jersey, Illinois, Florida, California, Arizona. So if we just finish analyzing the younger age group, so we can try going to the older age group. So let's try older age group. So let's do 65 to 85 plus. So here we go. We select the age groups that we want. So okay. Ooh, this is not going well. Okay. There we go. So there was a bit of a lag. But this is with the older age group, and then we can see that age is definitely an issue. There's an incline. Sex is pretty balanced at the older age groups. And then if we go down to diseases, see there's now, there is Alzheimer's, diabetes, there is heart failure, the flu, hypertension, high blood pressure, and then obesity drastically decreased because obesity is not an issue that older people have, as we can see from this data set. And then as you can see from here, the states are around the same, a lot in the United States. We do see more of the other states now, so that means that age is definitely an issue. As you can see now, a lot of more states have some sort of data for it, and then Georgia is definitely an increase. So as you can see, age is definitely something that COVID-19 is targeting. If you're older, it might hit a bit harder on you. And then now I just wanted to share this meme that I found. So you have to avoid touching men, which is your mouth, your nose, and your eyes. But you should follow women, which is to wash your hands, obey social distancing, mask up, exercise and eat well, and no unnecessarily traveling. Everyone stay safe. Thank you for listening.